So these are the muscles of the back, so the lumbar muscles and the cervical ones. So these are the spinal ones that are going to obviously help support the spine and also aid movement. So the first one that we've got is splenius. So that comes from T1 to 3, so thoracic processes, and then inserts up onto the nuchal crest. And this one aids extension of the head and neck, so it's going to help to obviously elevate the head and neck. And then obviously if one side is acting, it's going to help with lateral flexion as well, so help bring the neck round to the side. Then the next part that we've got is the ilicostalis. So we've got a lumbar and a thoracic portion, so we're going to do the lumbar portion first. So the lumbar portion starts at the ilium, so all the way back from the pelvis, and then comes up and inserts onto the transverse processes of the lumbar vertebrae. So this is going to be more lateral, and then also the caudal ribs, so just in front of the lumbar vertebrae. And then the thoracic part does several adjacent ribs and the transverse process of C7. And then it inserts onto the caudal margins of the ribs of origin and the transverse process of C7. So it kind of like just hops along. So altogether it helps with fixation of the lumbar spine, also lateral flexion of the vertebral column, but that's just the lumbar part, and then it helps to draw the ribs caudally in expiration and draws the ribs cranially in inspiration. Then we've got longissimus, so this is again, it's basically a lumbar, thoracic, cervical and capitis portion. So we're going to start with the lumbar and the thoracic section first. So that comes from the spinous processes of the sacral and lumbar and thoracic vertebrae. So basically it's just going all the way up the spinous processes, and then inserts onto the transverse processes and the accessory processes of the lumbar and thoracic. So it's kind of, as it's going up, it's inserting as well all the way along. So the lumbar and the thoracic part is obviously going to just go as far as the lumbar and the thoracic region. And then the cervical and the capitis portion, they come from the transverse processes of the thoracic vertebrae. And they insert onto the articular processes, these are the little bony prominences on the cervical vertebrae, and then go all the way up to the transverse processes of the cervical vertebrae, and then the masetoid process of the temporal bone. So longissimus helps with fixation and extension of the vertebral column, but also elevation of the head and neck, and also lateral flexion of the trunk and neck when only one side is acting. Next muscle is the spinalis. So this is quite deep, so again you're just going to have to indicate where it is. So that's from the lumbar spinous processes, which is the thoracic portion, and inserts onto the processes, spinous processes, the cranial vertebrae, thoracic vertebrae. So it's sort of coming along very deep down. Then the cervical part comes from the cranial thoracic spinous processes and inserts on the spinous processes of the cervical vertebrae all the way up to the axis. Because this is quite a deep muscle, it's going to help with fixation all the way along, but when one side is acting, it will bend the trunk as well. We've got the next muscle, which is semi-spinalis capitis. So this comes from the transverse processes of the cranial thoracic vertebrae, and then also the articular processes of C3 to 7. So It's going to be like Helen's doing now, the distal part of the cervical vertebrae, but also going on to the transverse processes of the cranial thoracic vertebrae, so probably the first couple of thoracic vertebrae. And then inserts onto the spinous processes of the cranial vertebrae, of the cranial thoracic vertebrae. And then it also inserts onto the nuchal surface of the occipital bone. That helps with head elevation and lateral flexion of the head and neck. Then the next one we've got is multifidus. So this again is built up into several parts. So that's cervical, thoracic and lumbar. So we're going to do the cervical part first. So that is the articular processes from the sacrum. So that's all the way back to the axis. So it goes all the way up and inserts onto the spine of the axis. Then the lumbar and the thoracic part does the mammillary, so again the bony little prominences on the vertebrae, all the way from the lumbar and thoracic to the spinous processes of the vertebral three segments, cranial to the vertebrae of origin. So it's basically jumping along the first three in front from origin and inserting there. So this is the rope-like one when it comes to dissection that runs all the way along like a rope, so it sort of jumps and inserts all the way along the vertebral column. This helps with fixation and rotation of the vertebral column. Then we've got rectus capitis, so that's the dorsal margin of the spine of axis, so right at the top, and inserts onto the ventral branch of the nuchal crest, so it's a very tiny muscle right at the top, but it's very important because what it does is it does dorsal flexion of the atlanto-occipital joint, so it's going to help with that movement right at the top. Then we've got the sublumbar muscles, so we've got quadratus femoris, lumborum. So sorry, that's not quadratus femoris, that's quadratus lumborum. So it's the last three thoracic vertebrae. So Helen's used the last rib there to gauge where she is. And the lumbar transverse processes. And then inserts onto the transverse processes of the cranial lumbar vertebrae. And what this does is it helps with fixation and lateral flexion of the lumbar and vertebral column. Then we've got psoas major, so this is part of iliacus as well, which forms iliopsoas. But what we're going to do is we're going to do psoas major first. So that's the vertebral ends of ribs 12 and 13. So these are your last ribs. And the transverse process is the cranial lumbar vertebrae. So the first couple of lumbar vertebrae. And it inserts with the iliacus into trochanter minor. So that's going to be down onto the femur. It's going to be extremely medially. It's right up ventrally underneath the dog. And because of that, it's going to be able to flex the hip and draws the limb forward, but also is a supinator of the hip joint, but also helps with spinal stabilisation. This is a really important muscle in agility and working dogs because it gets damaged quite frequently. Then the iliacus, which forms obviously part of iliopsoas as well, is the sacropelvic surface of the ilium, so that's going to be very ventral as well, right up underneath the pelvis. And it inserts with the psoas major, so it inserts on trochanter minor, and it has exactly the same function as psoas major. So them two form iliopsoas. Then we have psoas minor as well. So that is the last three thoracic vertebrae. So again, you're going to use your ribs as guidance. And the first four lumbar vertebrae. And then it inserts onto the psoas minor tubercle of the ilium. So again, you're just going to have to point where this is, because this is going to be a tiny element right on the pelvis. And what that does is it helps with ventral flexion of the lumbar and vertebral column. Then we've got sacrocaudalis. So this is the miliary articular processes of the caudal vertebrae. So that's of the lumbar region, so it's going to be really far back, lumbar sacral region. And inserts onto the spinous processes of the sacral and the caudal vertebrae. So this is coming really far back now. But what it's really important at doing in the dog is elevation and lateral flexion of the tail, which is what we need. Then the last one is coccygeus, so that comes from the ischiatic spine, so that's going to be in the pelvis, and inserts onto the transverse processes, so it's going to be more lateral of the first four caudal vertebrae, so that's going to be in now into the tail. And what that does is that helps with the dog actually to be able to wag the tail from side to side as one side acts. If both sides act together, then they clamp their tail down so you can't get to their back end. And that is all your muscles.